just waiting for a few more participants.
Yeah, no problem.
Yeah. Hello again. Good afternoon and good morning to everyone. Can we? Is it okay for everyone to wait for 5 more minutes to let a few more participants to join? Like last time, this is gonna be a small group, so we just want to make sure we have a couple more before we start. So 5 more minutes. Thank you. Hello. So, good afternoon again. Welcome to those who just joined. So, it's already 10:35 IST, so we can start now. If everyone is okay, can I get a thumbs up? Yeah. So we're going to start. Before anything else, I'd like to give us all a quick run through of our house rules. Okay, so for everyone's information, this session is being recorded and we will upload it later to various social media platforms. So at the moment, this is a small group, and most of you are members of TCI and have been working with the partners. So we also hope that you can be engaged in the discussion later on. But we request that when you are not invited to speak, kindly mute your audio throughout the entire session. And if you have burning comments and questions while the speakers are presenting, we encourage you to share them in the chat box only. And if you are invited towards the end in the Q&A, you may share your thoughts in the session itself. And also you can use the raise hand button anytime if you really want to speak. And of course, we want to promote this as an open and safe space for sharing and learning. And as a moderator, I will try to ensure this in the process. And we also encourage everyone to promote this. Okay, so I will stop sharing screen now. And if you are able to turn your video on, please go ahead, feel free. Right. So we can see everyone's faces. Thank you. All right. So a quick background of this learning session. This is actually the second part of a two-leg series. And the first one we already did last week. This is organized by TCI, Transforming Communities for Inclusion, which is a global membership-based network of organizations of persons with psychosocial disability. We also provided information last time about the microgrants program that TCI had managed during last year, from the start of the pandemic until mid of this year. We just actually finished it. And Bhargavi, if you want to say hi, Bhargavi is the director of TCI and head of secretariat. You are on mute.
Yeah. So good morning and or good afternoon for many of you. I hope you can hear me. This is I'm using my phone today and not sure if I am audible. So am I okay, Khalil? Can you hear me?
Yes, it's clear.
Right. Thank you. So transforming communities for inclusion is it used to be Asia Pacific, TCI Asia Pacific. In 2020, we became global with the support of many of you. Anirusa is here, Vakar is here. So many of you were instrumental in making this a global membership-based organization. And we have focus on the realization of human rights for all persons with disabilities and focusing specifically on persons with psychosocial disabilities. Our journey started in 2013. At that time, we were a strategy group, just a project of different organizations. And then the project became an organization in 2014. We called ourselves TCI Asia. 2018, we became to TCI Asia Pacific. In 2020, we have membership in about 30 and plus countries, more coming, with interest in the global entity. So we encourage all of you to look at our website and connect with us. The important quality or important platform that TCI offers is opportunities for taking up fellowships, developing DPOs at the national level. So we offer small grants for as startup for emerging fellows and for emerging DPOs. We would like to see the world dotted with a number of small organizations which have the opportunity to build their capacity to, work at the national advocacy level on the inclusion of rights of persons with psychosocial disabilities within the development scenario. Our membership is presently open. We are trying to update our website so that we have more members writing in. The secretariat itself is very small. We really depend on and we encourage a thriving membership. And I think today we have over a dozen very strong leaders at the country level in various countries in the Asia Pacific region. We'd like to do the same in the MENA regions, in Africa, in West Asia, East Asia, and in worldwide. So I would like to also share a little bit about our learnings on what inclusion means for us. For us, first and foremost, it means that we look at the whole development canvas and not just look at mental health reform. If we have to move the sector from the medical model to the social model, we have to be looking at housing, at social protection, jobs, employment, livelihoods, completing education, inclusion in the financial sector, financial inclusion, political participation, being in the forefront of advocacy for our rights within the cross-disability movement, engage with the CRPD monitoring process at the country level. So there's a whole range of works to do. And we are not just going to be talking to mental health professionals to give us better services. So this, I think, has been a very standard and very strong advocacy platform and position for TCI since the very beginning. That's how we identify not as user survivors of psychiatry, but as persons with psychosocial disabilities. And this is a positioning that was named and articulated in 2013 itself when we formed the first strategy group. Most of our members, nearly all members, have very strong networks with the cross-disability movement. Secondly, we ask for preconditions, legal preconditions, so deinstitutionalization, removing legal barriers to enjoying full legal capacity. So this is one part of our advocacy. The other part is very strong community support systems. In fact, this is part of a series of webinars we have been doing and we will continue to do on how within the country context, within a particular cultural language context, we will have strong community support systems. Recently, our learning has been that when people talk about peer support, it is seen as a mental health service. And we are trying to now articulate a position where peer support is seen as a community activity, as a community cement for persons with psychosocial disabilities as part of the larger disability inclusive development rather than as a mental health service. So these are some of our learnings that we look at inclusion as a very wide canvas, and TCI has a role in gender equality and climate change and all the SDGs goal, not just health, which is SDGs 3. So we hope to bring this all-embracing perspective. Many of our leaders, including those who are speaking today, Yeni and Bakar, have a very broad vision for our inclusion within development and within society at large. So thank you so much, Khalil, for giving me this opportunity and inviting. Please do look out for our call for memberships, call for opportunities, all of that. and particularly call for micro grants. Micro grants has been a very successful initiative of TCI, thanks to Khalil for holding that space and coordinating all activities relating to the micro grants. And it gives a really tiny module and small amount of money for people to create advocacy tools and community development tools. So we look forward to engaging with you on these. Thank you so much.
Thank you so much, Bhargavi, for that wonderful introduction of TCI. And I would like to highlight what Bhargavi mentioned about the comprehensive understanding and definition of inclusion, because it's something that we have also seen in the implementation of microgrants led by partners in 6 countries. And if I may name them, this is in Fiji, Indonesia, Malaysia, Nepal, Pakistan, and Thailand. In the first session, we shared an overview of the different outcomes and different results that have been achieved by these projects. And to name a few that we tackled a bit from the last session is increased food security and access to income, because we have noticed in different countries that this is quite a challenging area experienced by persons with psychosocial disabilities since the pandemic started. It actually worsened because even before, it was already an issue. And we also saw strengthened capacities of persons with disabilities to respond to the needs of their members. It's something that we can also expound in this session, because we also have examples from the 2 partners focusing on this. And of course, last time we focused on strengthened peer support system. And as Bhargavi mentioned, this is not really focused only on provision of service, but really seeing the support in the community as a sustainable effort to promote well-being of individuals. And for this session, specifically, our theme is to look at the visibility and inclusion of persons with psychosocial disability in the government's responses and programs for COVID-19. And examples from our guests, Yenny from IMHA and Wakar from PDRN, I will introduce them a bit later. They have focused on improved data collection and research, increased awareness among various stakeholders and the general public, and of course, improved accountability of duty bearers and the government. And some of the key specific themes that they did are focused on the implementation of the UNCRPD and deinstitutionalization, social protection. So those are some of the things that we will tackle today. So I'd like to welcome you all to our 2 guests for today. First, we have Wakar Puri from Psychosocial Disability Rights Network, or PDRN, from Pakistan. The organization was founded actually during the pandemic, and their vision is to build a strong national advocacy network of people with psychosocial disabilities to ensure full and equal participation in society, particularly in Pakistan. So they are doing public awareness and anti-stigma campaigns. They do referrals for alternative therapy, trainings, empowerment, and advocacies for persons with psychosocial disability. They are actually supported by a host, a fiscal sponsor called Special Talent Exchange Program, or STEP, which is a cross disability organization promoting empowerment of all persons with disabilities in Pakistan. Of course, they use rights based approach, and they also have a wide range of initiatives similar, more or less similar to PDRN, but they also promote and develop accessible information and accessible environment. And of course, they also work on strengthening systems. So Wakar, would you like to say a word?
Yes. Thank you so much, Khalil, for inviting me today. And thank you. I see so many people here joining and listening to us also. So I just want to say that my name is Vakar and I'm representing here as for PDRN, and we are supported by STEP, as you have already mentioned. And I'm looking forward to a great discussion between us today.
Thank you, Wakar. I'm glad to have you here. And our next speaker is Yeni from Indonesian Mental Health Association, or IMHA. They are the only national organization of persons with psychosocial disability in Indonesia, and they have a critical role in promoting a wide range of advocacy initiatives in the country, in Indonesia, pertaining to housing, social protection, political participation, education, and employment of persons with psychosocial disability, to name a few. So their overall vision is really to shift the governments and communities' perspectives and attitudes from the medical framework to human rights based framework and approaches. So, welcome, Yeni. Please say hi to everybody. You are on mute.
Hello, everybody. So nice to see you today. Hello, Wakar, soon to be groom.
Yes. Thank you, Yeni. And yeah, so we'd like to begin this conversation with you on what you have observed were the key responses of the government when the pandemic hit. But I would like to give you a little bit more time to just reflect on that. I would like to acknowledge as well our participants who are here with us. If any of you, since this is a small group, if any of you would like to say hi to everybody and maybe turn your video on, please feel free to do so. And if not, may I invite the rest to please send in the chat box your name and the organization you are representing, or from which country you are from.
Hello everyone, this is Kashif. I am from International Disability Alliance, working as a financial risk manager based in Pakistan. Thank you.
Hello, Kashif. Thank you for joining us. And thank you for introducing. Anybody else?
Yeah, hi everyone. My name is Agus. I'm from Indonesia. I'm from organization of person with psychosocial disability. The name is Remisi. It's a new organization of person with disability. So I very glad to be here and just want to say hi to everyone that I already know, most of you. Thank you.
Hi,
Agus. Thank you for being here. I also see Ira.
Hi, I'm Ira, working together with Jenny and Fadel and Chitra, and there's another one, Anam. We are from IMHA. Hello.
Hello, thank you, Ira. Fadel, I can see you.
Hello.
You still mute.
Yeah, I got my hair.
So, what happened?
Yeah, just refresh and release my my head. Hello everyone, I'm Fadel. I'm part of IMHA, and there is I looking with Yeni, Ira, and everyone with title IMHA. Good to see you all.
Fadel.
Yeah.
Yeah, looking refreshing. We also had a message from Deep D from Fiji Islands. I serve as a disability inclusive development practitioner, a supporter and friend of TCI-Global. Thank you for being here, Deep D. Anybody else?
Kim, long time no see. I miss you.
Hi, I am Kim from Living Association Thailand. I'm looking forward to hear Yenny and Waka speak.
Thank you, Kim. Kim was also with us in the first learning session where she shared about their initiatives in Thailand as well. I see someone unmuted. Jesus Anam.
Hello.
Hello. Yes, we can hear
Hello.
you.
Okay. Thank you. My name is Jesus Anam from Indonesia, a member of IMH. I have mental disabilities. Yeah. Namely, bipolar and schizophrenia. I was treated in mental hospital. Thank you for TCI as a global organization for people with mental disabilities.
Thank you.
Anam
Thank
is
you.
our new activist.
Mm,
He is
that's
very
good.
good in writing policy paper.
Yeah, that's good to know. Thank you for being here. And Citra also sent in something in the chat box. Sorry, I can turn on the camera. I'm Citra, a project officer at IMHA. I'm based in Jogja. Thank you. And I see Boss.
Yes, thank you. Good morning and good afternoon, everyone. My name is Boss. Some in here may know me because I joined TCI Asia several years ago together with Kim, and I know Yenny and Bakavi. And they've been in Thailand before us last several years. So I'm a person with psychosocial disability and disconnected from TCI for a while, but I'm so happy to be here again with your warm welcome and looking forward to learn from everyone. Thank you.
Thank you so much, Boss. And we're also glad that you are here with us today.
Okay,
And
I'm
thank you.
sorry, I'm from Thailand. I'm member
Yeah.
of Thai Family Link Association. Thank you.
Yeah, thank you. Thank you everyone for introducing yourselves. I hope we did not miss anybody. And now back to the question given to Wakar and Yenny earlier. I invite you to share a little bit more, a little bit about what you have observed as the key issues in your countries that the government had to respond, and how would you describe their response from the very beginning, maybe up to now, if you have updates and if you would like to share on that. So um anybody can start, but I already see Yanni unmuted, so feel free to speak, Yanni.
Oh, I muted since the beginning, so it's okay. Um, uh, what I seen is a disorganized government who really not prepared to face this pandemic. At first, they denied the seriousness of the problem, and trying to play it down. But when the problem getting bigger and bigger, they started to get panic and do not really know what to start, where to start, how to start. And one thing that very very obvious in Indian government is that they do not want to apply full quarantine because they do not want to face the responsibility of you can say feeding the whole nation, because in our law concerning quarantine due to pandemic like this, if it's declared as a emergency, then the government have obligation to feed, quote unquote, to guarantee the livelihood of all citizens, and they do not ready to do that, so they keep on doing the half quarantine, which is not very successful at all, and it prolonged, the pandemic until it's exploded a few months ago when they opened our border too soon. So they open when they see that the cases is not that big anymore, and they see that many places in Indonesia like Bali really depend on tourism, and the economy of those places who depend on tourism is died down. They open the border, and then disaster happen like what is happening right now. So that's what I see the response of the government right now. I'm not yet talking about the how do the government include, or how do people with psychosocial disability be included, and how do we respond in this situation. It's just the general response of the government.
Thank you for that, Yenny. And I'm taking note that you said it's, if you can describe it, it's a disorganized effort.
Yes.
And for your project with TCI on microgrants, you worked with social care institutions.
Exactly.
And would you also like to share what's the situation there that you have observed, and what was the work of government there, if there's any?
Yeah. Right from the beginning, we already very concerned on the situation at social care institution. We've been advocating, or we've been working on the issue of institutions, social care institution in Indonesia for several years already. So right from the start, we got very worried because we know the condition. We knew the conditions, and then we received news after news after news on how people in institutions in United States, in Europe, especially those who care for the elderly, senior citizens, and also those people with disabilities, and those institutions, the residents becoming victims, and we got even more worried. So we wrote a letter to the president, asked them to gave attention to this situation, and we launched this letter with a press conference. We also deployed our friends within the House of Parliament to raise this issue, and they contacted Ministry of Social Affairs at that time, which is after that give order to the Director General of Social Rehabilitation to discuss this with us. So we had a discussion with the Director General of Social Affairs, and they made circular letters to all institutions in Indonesia, how about the health protocols that should be done, and about the education of effect of COVID-19 pandemic to the residents. But that's not really enough, because we were not a priority for the vaccine program. I mean, no matter how hard you try to protect with social distancing, etc., which is very hard in the institution in Indonesia. As you know, that the condition is very crowded. Vaccination is very important. So yeah, we made a position paper, a campaign video, and then we published it in webinar that brought together Ministry of Health in charge of vaccination with the Ministry of Social Affairs. So we have after that we finally managed to have a seminar in like a focus group discussion involving Ministry of Health and Ministry of Social Affairs to to have a vaccination program for especially residents of the social care institutions. It doesn't mean that we support institution, but this is a very emergency response to the situation of COVID, of course.
Mm-hmm.
And that one is quite a successful discussion, because after that the Ministry of Health asked Ministry of Social Affairs for their minister to write a letter to the Ministry of Health asking for attention to people with psychosocial disability who live in the institution. And then in that meeting, I said that actually it's not only us who need the vaccine. The vaccine also should be prioritized, not only for person with psychosocial disability who live in the institution, but for all people with psychosocial disabilities. And the person from Ministry of Health agree with that. And again, asked Ministry of Health to write a letter to Ministry of Health about to make vaccine a priority for person with psychosocial disability. And then again, I propose, actually it's not only for person with psychosocial disability, but all person with disabilities need to be priority in the vaccine program, because the program prioritize, one is the health workers, the second is the essential workers outside of the health workers, and third is the senior citizens, not yet person of disability and and others. And again, Ministry of person from Ministry of Health agree with that. So that program, that discussion kickstart the whole program, the whole vaccination program, not only for person with psychosocial disability, both in institution and outside of the institution, but also for all person with disabilities. So I think this is one of the things that very important, that in Indonesia, I think I see the culture in Indonesia. When you talk about the necessity to focus on a program to focus on person with specific disabilities, we never forget to mention that it is also needed by other disabilities. We also did this with the free transportation. Actually, it's us who lobbied the government of Jakarta at the time, but we proposed that it should also be for all people with disabilities. So now in Indonesia, there are a massive program that targeting a person with a quite massive program. It's just a start for person with disabilities. And I think that's very important lesson, that even though we start from one specific issues of disabilities, we can spread that out to be not only a program for psychosocial disabilities, but also program for other disabilities as well. And while doing so, we also see that one government program that really becoming a star during the COVID is the social protection programs, or social protection programs of the government. That's becoming a backbone, a backbone during this disaster, during this period. This is the program that people talk about, people speak about, people demand about. And so we thought that it is very important to really, ride the wave, because we do not really have like a specific social protection program for person with disabilities in Indonesia, that we need to use this opportunity to propose to the government what social protection scheme that we need, in Indonesia for person with disabilities. And of course, we cannot do that just by ourselves. So we propose this to cross disability movement. And we had a we have a series of seminars, focus group discussions, and other, we have a very intensive series of webinars and FGDs to collect information and data, and to write down a policy paper about social protection that we will propose to the government and be used in the future. and we work together with social protection expert from many from a social protection consultant that used to work that work with the government. So we also knew the point of view of the government. This is still ongoing project, but this is very important project because we involve how many organizations, Fadel? 30, 40 for the social protection program? Hello? Yeah, we involve about maybe 30, 40 cross disabilities organization, and we let the process, and hopefully, yeah, it will finish soon, and then we can propose it to the government.
Thank you for that extensive sharing, Yanni. I'm picking up these efforts that you have done, and I would like to go back to it again a bit later. But now I'm curious, since you mentioned that persons with psychosocial disability who are also residents of social care institutions were not prioritized in the vaccination program. Did you observe the same thing in other services in the beginning of the pandemic? So for example, in testing, because last year that was still our focus, testing, and then medications, and then perhaps access to stimulus funds. Were you able to see those challenges as well in the beginning? And do you think the government really took an effort to map out the needs or
No.
identify the needs or not? Can you say something about that too?
Yeah. At the beginning, they had no attention at all to social care institutions. There is no data collecting. This is very disappointing actually, because they started to collect data on person with disabilities. And also quite disappointing is that when they start to collect data on the impact of COVID-19 for person with disabilities, they left behind person. This is the effort that also conducted by cross disability movement. They left behind, a person with psychosocial disability who live in the institutions. They said that it's too difficult because the data collecting is based on online and telephone, while the residents of social care institution in Indonesia do not have any access to cell phones, internet, etc., etc. So they are simply left behind, and there were no testing whatsoever. But the testing, this is also very interesting. There are no testing at all for social care institutions in Indonesia, and we started that program actually just to push the government to see that you need to do the vaccine, the testing. So we collaborate with the Standard Chartered Bank, and there are several organizations, CBM, that we conducted the testing ourselves in several social care institutions. We tested about, there are many, more than 4,000 residents of social care institution at the beginning of the COVID, just to push the government to give issue in this matter. So yeah, luckily at that time, because it's still at the beginning, the number who got infected is not very high yet, but then later on it's higher and higher. So yeah, at the beginning there is no action at all by the government. Even I remember that when COVID started, the national agencies of disaster management, that's the main agencies that deal with disaster, including a pandemic like this. They have like a discussion involving people from various civil society organization, and it clustered based on several topics. I was involved and invited to be in that group. But when I started to talk about the importance of educating person of psychosocial disabilities in the institution, about the importance of health protocols applied in the institution, the urgencies about testing person. I mean, when I started to focus talking on on the institution, then I was not invited anymore.
They got
that's
threatened, maybe.
that's when we wrote letter to the president. Before I kind of like, okay, good. So we are invited. It means that we are involved, and hopefully that we can share our concern, you know. But then when I started focus on that issue, and they probably thought that that's too difficult to deal with, and it is not a priority. It's only a bunch of person with mental illness probably, and they think that it is not worth to give their attention, and they stop inviting me. And that's when we wrote the open letter to the president that gained, you know, attention.
Thank you for that. So I have a lot of questions, but I'm gonna park it for now. Perhaps we can also hear from Wakar. Wakar, what you think were the key issues that you observed in Pakistan for persons with psychosocial disability, and how did the government respond to that from the very beginning up to now? And I think you can also, since Yanni already mentioned some of their initiatives to respond to those problems, you can also connect it to that as well. You can already mention what kinds of efforts you did with PDRN and STEP. Yeah.
Thank you, Khalil, and thank you, Yanni. I've always seen when you start speaking and you just, you know, you have lots of things to say. So it's been great hearing you. So in Pakistan, basically the situation has been very worse because there is very lack of awareness of persons with psychosocial disabilities in Pakistan. And there are very, very limited organizations of persons with psychosocial disabilities in Pakistan, where, like, I would say that there are no DPOs in Pakistan. So this is one of the biggest challenge. And when there are no DPOs, there is very less number of participation of persons with psychosocial disabilities who are ready to, you know, come out of their homes, advocate for their rights. So this is where this is why, because the situation in Pakistan has been very worse. And due to this, the cross disability organizations across Pakistan, they also don't have awareness, because if people with psychosocial disabilities will collaborate and partnership with cross disability organizations, then it will be a collaborative effort, and they can go to the government, because we cannot say government is bad. Government is not at all bad. Government is not aware. It's not sensitized. So so this is one of the major issues where we say that inclusion was not possible of persons with psychosocial disabilities in Pakistan. If I see the social protection scheme, Kashif Saab is here. The social protection scheme, the Prime Minister Imran Khan, he initiated a scheme for the COVID-19 response, and there was some cash transfers, there was some food distribution going on in Pakistan. But the criteria was that on the basis of poverty, that's it. And the priority was not given to the minorities, the underrepresented groups or persons with disabilities. So this is where our government lacks. And I also, during the COVID grant, I got a chance to visit the institutions also, and I saw that and we also distributed some you know, the hygiene and COVID prevention kits in the institutions also to persons with psychosocial disabilities, and the situation there was very worse. Like, there was no COVID SOPs being followed. There was no social distancing, unhygienic and very untidy situation inside the social care institution, though it was not a government facility but a private one, but it was not the services was not very good. And then during the pandemic, if we go back, we see that everywhere it was a lockdown. There was a complete silence. There was no you can say the health facilities available. There were no peer support networks, because in Pakistan we have seen that there are so many service providers. Service providers are like number of service providers, and they were also not available during the COVID times. And the person with psychosocial disabilities were unable to access the health facilities. They were unable to access peer support. There were many persons with psychosocial disabilities were unemployed, because they were not and due to their unemployment, uh, there the government lacked. They were not provided with the social protection. They were not given the cash transfers. If the cash transfers was given to them also, they would be able to cater with their daily needs, and they would be able to cover their disability related costs. So this is where our government lacked. And also about the vaccination, like Yenny mentioned, that there is a need to prioritize persons with disabilities, not only persons with psychosocial disabilities, but persons with disabilities. And we have been working in this process with the cross disability organizations in Pakistan. We have been doing consultations at a national level. We have been organizing webinars in Pakistan with STEP. And STEP has supported PDRN a lot in this perspective. And we were able to, access the national committees on the rights of persons with disabilities. Yes, NDMA, like Yenny mentioned, National Disaster Risk Management, they were not at all bothered. And one thing, when we talked to the National Disaster Risk Management Authority about the inclusion of persons with disabilities, and the response was that they are not, that persons with disabilities they're not priorities at the moment. Their priorities are vaccinations. Their priorities are to put on lockdowns on people, and decrease the risk of COVID spread. But their priority was not to identify different groups of people and how what challenges they would be facing during the lockdowns. So this has been a challenging time for all persons with disabilities in Pakistan. If a very simple thing, like I think very less number of vaccination centers would be accessible. Persons because the some vaccination centers are made in the government. Many of the vaccination centers are made in the government facilities, and most of the government facilities, they are inaccessible. The buildings are not accessible for hearing impairment, for persons with physical disabilities, persons with intellectual disabilities. So government has been, and we have been doing this with STEP. We have been collaborating with STEP in this, and we have been advocating on this to the Parliament House, with the members of the National Assembly, with the ministries, to include people with disabilities, not only persons with physical disabilities, not only persons with psychosocial disabilities, but in a cross disability setup. We bring all disabilities together, we advocate together, and we have talked about our inclusion. And even with Ms. Sania Nishtar, who is the Minister of the Special Assistant for the Social Protection Schemes in Pakistan, we have also talked with her in collaboration with STEP to include people with disabilities in social protection schemes. And then again, as Yanni mentioned, data is one of the biggest problems, because the tools being used for data collection are not inclusive of persons with psychosocial disabilities. Recently, there was a PSLM survey in Pakistan, and there are new figures in Pakistan now, because in 1998 there was first census, and in that census it was the statistics division gave us the statistics that persons with disabilities are 2.49% of the total population. And then they conducted in 2018, they said persons with disabilities are 0.49% of the total population. Now, how is that possible? Whereas WHO says that there are 10 to 15% population of persons with disabilities. So recently there was a PSLM survey, and according to that survey, the recent statistics are that there are 9 to 10% persons with disabilities in Pakistan. but that survey was not inclusive of persons with psychosocial disabilities. So we have also been in touch with the statistics division for this regard, and we are trying to support the government in making their programs and making their response inclusive for persons with psychosocial disabilities.
Thank you, Wakar. That's also a lot of initiatives that you have done. I find it particularly interesting that you mentioned about the need to have a capacity, capacitated DPOs to really lead the advocacy for persons with psychosocial disability. And you mentioned that there's not really a lot of DPOs there, and that limits their participation in advocacies. And you also noticed lack of awareness in the general public. If you can perhaps elaborate a bit more on this, what
Yes.
kind of support did you provide? Because you worked with PDRN. What kind of support did you give so that they can strengthen their advocacy capacity? And you talked about webinars and trainings. I'm wondering if they were already involved there. What's the nature of these webinars? If you did this for the general public, was it in response to that lack of awareness that you mentioned earlier?
Yes. I really thank TCI for providing this opportunity to PDRN. And PDRN is first. I think it would be a first organization which was formed in this COVID times, and we have been operating completely online with our members, with cross disability organizations, with other partners. And what we did is we have created different social media pages on Instagram, on Facebook, and we are awareing our general public from there. We have created some couple of videos on COVID-19, on Article 11 and COVID-19, and we are providing awareness to general public from there also. We have also developed IEC materials during this COVID grant, which was distributed along with the COVID prevention kits to different partners, to persons with psychosocial disabilities, to government. Wherever we had to visit, we also provided those materials to them, so that at least government knows that there is a DPO of persons with psychosocial disabilities who can support us in this development programs. The consultation process we have been doing with the different cross disability organization, and we developed response papers. We developed response letters, and we wrote those letters to the ministries, which was sent to the ministries, in which we mentioned what are the challenges persons with psychosocial disabilities are facing during the lockdowns, and what needs to be done. Unfortunately, there was not a response from the government on that, but we have been doing follow-ups with ministries. We have been doing meetings on those, and with Ministry of Planning and Development and Reforms. We are also their committee members on the planning and development of the different initiatives they are bringing in Pakistan. On this, we were also made part of the PDRN was also made part of the special committee which was established by the Speaker of the National Assembly, Mr. Asad Kaisar, and through that committee, PDRN has been involved in the development process, and we have been advocating on that platform for the inclusion of persons with psychosocial disabilities along with other cross disability members.
Okay, that's very interesting. I think it's also common between your approach there in Pakistan and also in Indonesia to work with the cross disability movement. But aside from them, did you also have other allies in terms of other organizations, or this is really mainly with the disability organizations that you are, promoting inclusion of persons with
Yes,
psychosocial
yes,
disability? Yeah.
we definitely have allies with us working on the disability issues, and there were different partners like Saver International, CBM, Humanity and Inclusion, and cross disability partners from the national level who have been created this platform at a national level, and it was being established by the National Assembly by itself. So they ensured the inclusion of diversified groups in the committees, and so that everybody can be involved in the response process, and they can give their feedback on that.
Thank you for that, for clarifying that. And I also see Yenny unmuted and turned her video on. Would you like to add, Yenny? Would you like to also give us information about the allies that you worked with, maybe with the cross disability movement and maybe other organizations?
Yeah, ally is very important. My vision in the future is that the disability issues is not only advocated or is not only part of the disability movement, but it becoming an issue of all civil society movement, just like gender issues. Like when I used to be a long-term women activist before, so we always try to make a gender issues to be a mainstream issues in all organization, in all sectors of life. That's also my visions in the future. For example, like when we talk about disability and employment or the situation in the workplace, I hope one day, and I'm glad that Anam is here because Anam used to be a labor activist. I hope one day that the how do you call it, the struggle, the works on the rights of persons with disabilities in the workplace is not only voiced by disability groups but also by the trade unions. Also, when we talk about the person with disabilities in the rural areas, it's not only, I hope in the future, it's not only voiced by organization of person with disabilities, but also for the farmers organizations, because we have a lot of farmers organization in Asia, and it will be nice is one day they also take over the issues of disabilities in Asia. So yeah, it is very important to talk with other sectors in the society, not only disability groups. We already started with the women's groups. We supposed to have like a women convening last month or 2 months ago, where well, it's keep on postponed. It's supposed to be like a convening of women with disabilities activists and women without disabilities activists. We are going to have like a 3 days convening, and we will end with a declaration. Actually, we plan to do that. So there is like a like official collaboration between activists of disability movement and activists of mainstream women movement. And we also already involve many of human rights and legal aid activists. We gave training to legal, we gave CRPD introductory training to legal aid, several legal aid organizations in Indonesia. In Indonesia, we gave CRPD trainings. We also gave CRPD training to the women organizations in Indonesia. So we gave trainings not only to disability organization, but we also gave trainings to legal aid organization, women organizations, and yeah, we have allies. One of the allies that we are looking for in the future, hopefully we can involve them soon, is the environmental activists, because we also plan to tackle the issue of climate change, and it will involve, of course, environment organization and environment movement in Indonesia.
Yeah, thank you. So it's really just a lot of opportunities being opened up that we can do more in the future. Wakar raised his hand. I think, Wakar, you want to follow up on
Yes,
Yani's point?
I was, curious to say about this, that when we were talking about the allies, and I really wanted to, emphasize on this, that due to this COVID grant, we were able to, come into the mainstream, and we were able to, at least show our faces in the, in the development process, and we were able to, access the different platforms where inclusion is important, and where should we where it is important for the cross disability also to involve a diverse group of persons with disabilities. So here I wanted to due to this COVID grant, we were able to even do more after this, and we were able to take part in the different consultations at the national level. Different different organizations started contacting us for support, and we were also able to take part in different national consultations related to GDS, and we also led this process with STEP. So these are the opportunities which were coming out of this micro grant, COVID grant, and because this COVID grant built our capacity in this terms, and we were able to step into more some different areas also.
Okay, thank you, Wakar. And there's a comment from Deepti. I also believe human resource institutes or associations could also play key towards employment inclusive policies and disability inclusion. So yeah, we're really underscoring the different allies that we could work with. And actually, it's interesting, we started this discussion with really looking at the response of the government. But as we have observed in the sharing that you gave us, we're also looking at how we could influence the general public in terms of their perspectives and behaviors, and also working directly with organizations of persons with disability, because they would take the lead in really pushing these advocacies forward, and working with other organizations, including cross-disability organizations and others beyond. As we have said, moving forward, we want this to be something that is taken by all kinds of organizations, and not just by the disability movement itself. So I think those are key ingredients for us to be able to really strengthen our engagement with the government. And before we proceed to more questions, I'd like to actually request everyone, to the participants that we have here, if you have questions or additional comments, please put them in the chat box, or you can raise your hand if you want to speak. I would like to invite Bhargavi at this point to maybe share your thoughts, initial thoughts about the sharing so far. If you would like to, yeah.
Yeah. Thank you so much, Khalil, Wakar, and Yeni. I think that, this is the second microgrants webinar. I'm so glad that the sharing here is going out as a video on social media to larger membership and to groups who I hope will be interested to set up such national advocacy processes, of persons with psychosocial disabilities. In Yeni's work, we have one of the best examples of what, small support, DPO support can go. Of course, they are also supported by various other organizations, but it is the strongest example of TCI membership, taking national advocacy to a very, very high standard of inclusion. And I think she has set a bar which is difficult to match. And I hope that she will be a good mentor for other organizations which are developing DPOs. So I would definitely, as a next step and a next learning session for TCI, propose that Yeni be offering a learning webinar on national strategies for advocacy on inclusion, along with several other members like Wakar, and Kim is here. Kim has done amazing work with the government in Thailand, and there are some really good examples of national advocacy work, and it's a theme that many DPOs will benefit from. And the second point I want to just share, listening to these presentations and also to the kind of work that happened with the other micro grants, whether it is Miyasa in Kuala Lumpur or Kim in Thailand, Living Association in Thailand. We are looking at the broad spectrum of SDGs. It's not just cross-disability movement and human rights of persons with disabilities, but it's climate change, it's indigenous people, it's women with disabilities, children with disabilities, it's farming, it's it's youth, young people with disabilities, with psychosocial disabilities. Agus's work here, Agus is here today, his work in this regard, Sadam's work in the northeast of India. So I think it's a broad spectrum of interventions at the national level. The third point is that whatever grassroots actions we are all doing, whether in terms of farming or mobilizing young people or mobilizing the LGBTQI communities, whether we are mobilizing, green activists or women's activists, how do we take it to national policy level? In some countries like Nepal, Pakistan, even in Thailand, the governments are accessible. In larger countries like China, South Korea, India, it's so difficult to do this. So we have to think extra hard to see what kind of strategies we can build up as TCI and membership to reach to countries where government accessibility is bit low. But wherever TCI members have worked in this more universal way, they have been able to reach the governments and show some good amount of successes. Our voices are being heard at the government level. And I think the micro grants have really, the point that Wakar was making, the small grants, it's not a large amount of money, but people have been able to use that money well to reach their governments. So yeah, micro grants has been a very good, successful model for us to support national advocacy and empowerment of persons with psychosocial disabilities. Thanks a lot, Yeni, Wakar, and definitely Khalil for just holding the micro grants together for the short period of time that we offered it. Setting up a monitoring system, having good governance as far as getting the data out. So thanks to all the people who participated in the microgrants initiative.
Thank you so much, Bhargavi. And I think it's really important to highlight what you share, that beyond this, it would be good to really capitalize on the successful strategies that we have seen, we have observed from the partners that we have in terms of doing advocacy work and empowerment of persons with psychosocial disability. And again, we're not only focusing on mental health issues or specific themes that we are experiencing, but also on the broad scope of the SDGs as something that we are aspiring to achieve collectively. So we have about 15 minutes left for this session.
I would like to just something more.
Yes, please.
I would like to thank all the cross-disability organizations which have acted as partners, as as fiscal sponsors, as just taking in our inputs and also supporting us in a big way. I think in every country we have been successful, and the global level we've been successful because of support of the International Disability Alliance, for example, and several other Women with Disabilities Network. So we've had a lot of support from the cross-disability organizations in particular, and also the women's organizations. They've been really, really supportive. So just wanted to remember them in this context and say thank you.
Thank you, Bhargavi. And I saw Wakar raised his hand. Before we go with you, Wakar, this is I would just like to throw one last question, but you can answer it. This is at the same time I'm going to give the floor to you. But as closing, what key challenges or gaps are you still observing at the moment that you think should be the focus of any immediate or future efforts regarding what we have discussed? And yes, Wakar, the floor is yours. You also have additional thing to say.
Yes, thank you, Khalil. Basically, I wanted to, emphasize on this particular thing. And the same question which you have raised, I was going to talk about the same thing, that what is now needed to be done. Because, yeah, so it is important that, like I mentioned, that there is a need to, establish more and more organizations. And it's really good to see that the micro grants program has been very successful, and we hope for next micro grant program coming up very soon from TCI. And I think it is very key to to support more and more organizations in different provinces. And through that, what will happen? We will be able to we will be able to make our network more stronger at the national level. And there is a need to advocate with the government on the social protection schemes, like why it is important to cover the disability related cost. Because and when you talk about social protection, you have to work with the statistics division, you have to work with the finance division, because there is a need to allocate budget at the national level for persons with disabilities. There is a need to establish a national disaster risk management committee at a national level, which should directly be only focusing on the disaster management, such as COVID-19, because and only organizations of persons with disabilities can prioritize and tell their issues, their solutions, everything. Because we have seen in this we have seen in our country that issue is about persons with disabilities, but decision makers are not persons with disabilities and they are not involved. So it is important that we advocate at the committee level, at a ministry level, so that they can involve persons with disabilities in the whole development process. And they involve persons with disabilities in the response programs of disaster management. There is a need to to analyze, to see what challenges persons with disabilities are facing during the lockdown systems. And then there is a need for the government to consult with the organizations to basically that is a win-win situation. You are winning when the government is calling you. If you are going by yourself, the government is busy somewhere else. So there is a need that the government itself is aware and is sensitized, that it calls you at their platform to support them in the development. And as I mentioned, that the task force is one of the key things, which can be a key to include persons with disabilities in this during the lockdowns, and what has to be done, what needs to be done for the inclusion of persons with disabilities in the response. And then social protection, as I mentioned, it is one of the important things, because there is no social protection system in our country, and there is a lot of poverty, due to which many people, they are unable to access their or live their life as on an equal basis to others, because they are unemployed, they are not empowered enough to gain employment. They have very less livelihood opportunities. So it is important for the government to focus on these issues, because even in our trainings, if Yeni, you also have experienced this, Bhargavi, you also may know this, that IDA has always, taught this, teached us this thing that budget is something which is very important, and without budget, without monetary things, you cannot do anything in your country or in your programs anywhere. So budget advocacy is one of the key elements which where it is important for persons with disabilities to to advocate with their governments, to aware them that to allocate budgets for persons with disabilities, and then ultimately it will support the government in initiating different development programs for persons with disabilities at a national level.
Thank you so much, Wakar. And yes, indeed, budget is a crucial element in advocacy if we want to see concrete support and commitment. And of course, it's important to have an active organization of persons with disability there to also monitor how the resources are being spent as committed. And Yanni, do you agree with the recommendations from Wakar? What are your thoughts? Yeah.
Yeah, totally agree. Social protection and budgeting is one of the key issues. I mean, we have so many issues: legal capacities, work. I don't know where to start. We have so many issues, but yeah, I mean, relating to COVID-19, social protection is one of the key issues. And of course, when we talk about social protection, we talk about how much money the government have and how do they allocate things like that. And right now, IMHA is conducting research on budget allocation of the social protection scheme in Indonesia. So we have social protection scheme, but basically mainly is the universal health coverage. You have to pay because this is contributory, but if you are poor, like what Wakar said before, that poverty targeted, if you're poor, then the fee paid by the government, or the contribution paid by the government. One of them is that, and also there is a cash transfer for the poor family. And one of our main advocacy right now is to switch from the family-based direct transfer to individual-based direct transfer, and to switch that, because right now everything is based on the family. So in many cases that if the money goes to the family, it never come down to the person with disabilities themselves. And not only that, if the family is not poor, then the person with disabilities, even though they as an individual are very poor, not working, etc., still cannot access the cash transfer. So there are a lot of things that we work, but right now, one of the related to budgeting, we are doing research on the budget allocation of social protection scheme in Indonesia. And yeah, that's a few things that we need to think about in the future.
Thank you so much, Yanni. Actually, yeah, these are very focused recommendations and something that would be good to explore on as a continuation of the efforts that we did with TCI on microgrants. We have a couple of minutes left, and Bhargavi raised her hand, and also I would like to give a chance for you to share your last thoughts on this before we close. Yes, Bhargavi?
Yeah, thank you so much, Khalil. Actually, just taking off on the points that both Wakar and Yanni raised on recommendations at the national level, particularly budget advocacy. Here in Pune, we've been involved with a project on deinstitutionalization for the last 4-5 years. And one of our learnings is that the task of deinstitutionalization, we are a DPO, and it is there are some things that we can do as a DPO with our limited budgets, but people who've been inside institutions even for 2 years or 3 years, they feel the impact of the institutions, in many ways that we do not even predict. For example, most of the women who we institutionalized were at very high risk for corona compared to the women in the general population. There is a huge damage on health, or because of overdosing on psychiatric medications, the electroconvulsive treatment, just the hygienic sanitation, nutritional measures which are very poor. And the point that Waka was making, of course, Yeni has been really working on this. So there is a cost which, as DPOs, we cannot take. We offered cash transfers, thinking that, okay, we'll bring them out and we'll resettle them in places that where they want to live according to Article 19 and where they want to work. All of that we were able to, but we could not predict the huge impact that living inside an institution has made on their lung capacity, their ability to withstand infections, their overall health condition, the comorbidity that all these psychiatric medications in the long term causes, the bone problems. We were just not prepared for any of that. So definitely we are talking about government compensation for the harm caused by these kinds of harmful, cruel, inhuman, torturous treatments, which has been given to people, especially the poor, in the name of mental health care. This is not mental health care. This is really, taking people to their own deaths with really bad kind of offers of services. So this is something that really we have to have budgets for deinstitutionalization. It's not just about work and housing. It is about the independent variable that comes in because of the impact of institutionalization on people's health and well-being. This is a separate cost altogether. This has been our key learning. And so we are talking about reparation. We are talking about compensation. We are talking about over and above social protection. Social protection is everybody's need. But there are needs of people who have been living inside institutions that the government must take. So this is what we are saying. So I'd like to thank everyone. It's been an amazing session as always. Being with our partners and members. It's been amazing. So thank you all so much for that. I'd like to thank Open Society Foundation, International Disability Alliance, Wellspring for the micro grants opportunity, and OSF has already expressed interest. IDA is super supportive of the idea of micro grants. So as Khalil said, as Waqar said, there will be a immediate rollout of this plan. Looking for empowerment. Particularly, I see Deepthi is here. If you can spread the word in the Pacific, we'd love to support the Pacific Island groups. I know that we have, Yeni talks a lot about this. And this was Yeni's idea. I'd like to really also thank Yeni, because from the beginning she says that, okay, give a fellowship, that's fine. But after that, what happens? So this kind of startup pool grant is good. And I think it also makes it convenient for people and members to access us instead of independently some other donor agencies. Just one last point. We are trying to interest international donor agencies, investors, all of them with the idea that if you're looking at supporting community programs for inclusion, then look carefully, when you talk about peer support, because you have to ask the question whether peer support is part of a mental health service. Do you really want standalone mental health services, or do you want to invest in community support systems? And today we've heard the spread, and the other day also when we had the first webinar, we had the spread of ideas on what all a DPO can do in the context of inclusion, within SDGs, within development, within all of that. So we are also very much advocating with the donor agencies to consider, what kind of inclusion programs they want to support, what kind of strategies they want to support and invest in. So this has been, this has been also, of course, putting this thought out on inclusion and community support systems through our webinars, through the Conference of State Parties, through academic presentations. So we've been doing all of that. We look forward to having many of you together with us in our journeys forward. So thank you for being here with us today. And thanks a lot, Khalil, for this amazing platform that you have created for learning.
Thank you, Bhargavi. That's a lot of food for thought to carry with us. Something also, I mean, personally for me, you talked about reparations and compensation. It's really indeed a completely different thing when we talk about budget. And of course, overall, we are challenged to really rethink the way we view mental health and our lives as persons with psychosocial disability. That's a large conversation to undertake. But anyway, thank you so much, Wakar, Yani, Bhargavi, and everyone who is here with us this morning or afternoon. So again, we will share the recording soon and we'll inform you via email. Thank you so much. I will not keep you longer from here. So yeah, bye everyone. Thank you.
Bye-bye.
Bye.
Thank you.
Bye,
Bye.
Wakar.
Bye.
Have a
Thank you
nice
so
wedding.
much.
Bye.
Have a nice wedding.
Thank you,
Yeah.
Yanni. Thank you.
Okay,
Thank
bye-bye.
you.
Bye.